I was sitting here thinking, what could possibly be the best excuse that I can conjure up to to apologize for the fact that I just disappeared off the air since December, and I'm really sorry I did. But I was thinking I'm going to take a break, and then a fine opportunity presented itself for me to start a new business, and that literally took up all my time. I started something and I guess I have to finish it, whatever that means. I'm still not out of the red, but I am going to try my best to keep on producing episodes for you to listen to, stories to tell. As a result of the changes in my life for now, I will definitely not be as frequent as I used to be by publishing every Friday, but I will certainly push these episodes through as I start producing them. This is also a fine opportunity for me to thank you for the support so far. Thank you for believing in me, and thank you for those people that messaged me during this time, nagging and asking, please, when are you going to put out another episode? It was part of my drive and passion to get these compliments, and I felt so guilty for not putting out an episode every week. And I was having a chat to my wife and just saying, I absolutely have to. And it took a lot of my time, it took a lot of effort. And without further ado, here we go. Today is the first time back with a lovely episode, and I hope you enjoy it. And thank you once again for the support. I really appreciate you. Jude Wordsworth, thank you very much for joining us on the Gravel Travel podcast. Now, I just want to make this clear right from the word go. The idea, other than you telling us about yourself, and no doubt an interesting story and history which brings you to this point, the idea with this is not to create paranoia or fear into what we are already doing. I think it's more about preparation, and later you can, and I know you will, shed some light on this for us. I'm going to go straight into you telling us about yourself and to create a little bit of background on who is Jude.
Well, thanks, JJ. Well, thank you for having me and talking to me, first of all. It's a great experience and great to talk about what I do and why I'm so passionate about it. Starting with who I am. Well, if you haven't picked up already with my accent, I'm not really from South Africa originally. I grew up in the UK in a very small town in the north in East Yorkshire, and lived there till I was 18. Then studied in Nottingham, hometown of Robin Hood, and I did my medical school training there. And I pretty much moved to South Africa as soon as I'd graduated. So I've been here now since 2013, and this really feels like home.
Was there
now.
a specific reason I have to ask for moving here?
Well, actually, I traveled here when I was 18. I took a year out of school, year out traveling after school, and I jumped on a overland truck from Zambia and traveled through Zimbabwe, Botswana, Namibia, and down in South Africa. And I loved it. I fell in love with the place then. I loved Africa, particularly South Africa, and kind of had my heart set that I would come back and ideally work here for a while. Wasn't sure I would end up living here, but that's where we've got to, and I haven't looked back since. I met my now husband whilst I was in medical school, so he was definitely a positive factor in influencing the move here. And like I said, I haven't looked back since.
Brilliant. Now, you have to give us a little bit of background on your profession and your early choice to go down that road, so to speak.
I think I decided on medicine when I was maybe 14, 15. It's a choice you have to make relatively early on if you're going to pick the right subjects at school. And I had in mind that I wanted to do something in the science field, but something applicable, something to do with people. I thought about being a physio for a while, and I think it was other doctors on a sports trip that I went on that actually eventually influenced me in the mindset of medicine. They talked about the opportunities of traveling with it, of getting to do something you're passionate about, and that every day is different. And you're applying a science knowledge, but in a very day-to-day, practically relevant situation, and you're making a big difference in people's lives. And I loved the idea of it. I never wanted to be office bound. So it really appealed to me, and that's really where the spark hit. So I did my 5 years at medical school, and then when I got here, I did 2 years of internship. So I studied in Nottingham, but did my 2 years of internship at Leratong Hospital, which is Krugersdorp, which was a bit of an eye opener. Definitely moving from the sort of limited and protected medical training that I'd had in the UK to then full exposure here and thrown in at the deep end. But really, it's the best way to learn. And I learned quickly. You get a lot of experience, a lot of hands-on time, and you become competent quickly. And I really enjoyed that challenge. And from there, I'm now working as an emergency medicine doctor at Helen Joseph Hospital, which is another government. And I work in the emergency room, which is a combination of trauma, so major injuries coming in, and emergency medicine, so anybody who's acutely sick or ill with something. And I really love it. It's a fantastic challenge. Every day is different. You never quite know what's going to walk in the door. And that for me is what keeps me on my toes, keeps me learning, keeps me excited to go to work.
Any future dreams or aspirations in the field? Or, where do you think, is there a clear idea in your mind where you think you want to go with this?
Well, I enjoy this emergency medicine. I think if I was going to pick a specialty to go down further training into, it'd probably be in emergency medicine. I looked for a while at maybe doing pediatrics, but the nice thing with emergency medicine is that it involves both. It involves kids, babies, and adults. And you don't have to pick one field. You're really kind of doing a general treatment of just about everything that can happen from an emergency perspective. So, yeah, I think I've found what I'm quite passionate about, and I'm enjoying it.
You're not just a trauma specialist. I think your life has changed in many directions. Marrying Dave, who's a well-known person or personality in the motorcycle fraternity, and your life has changed around that in many respects. And where does that bring you as a trauma doctor and Jude, the motorcycle rider?
I had never been on a bike until I met Dave. And one of the first visits I had to South Africa after I'd met him was in fact, the first visit that I came to visit him here, he took me off to Nelspruit, and we spent 3 days test riding bikes in that Hazy View, White River, Sabi, Graskop area. And yeah, that's really where my relationship with motorbikes started, and I loved it. I had no idea that I would love it so much. And I really got the bug there, that adrenaline, that adventure feel, that open road and freedom. And I've loved ever since. And it's been a great new part of my life, joining these tours, the adventures, the rides. So yeah, I had no idea I would enjoy it, and he introduced me to a whole new world, and I've loved it. I also love the people that I think you meet. I think the riding fraternity is a very special community, and I don't think I've ever met more friendly people, a more diverse group of people, yet with a common interest that brings you together.
What I find very interesting as well, or I'm sure it's something you never expected in your life before, is the it's brought this very interesting element, a completely different element to your life when it comes to your profession, and in the mix thrown is motorcycles, and now you're using that to, I almost want to say, educate people, or how help people understand what is it that they can do to better their trip or their adventure.
Yeah, I think I found myself in that unique position where I had the interest from the bikes and the passion from that side. And I was involved with the motorbike fraternity in that world, but also had the professional interest from the medicine perspective, and particularly from working in emergency medicine. And we see on a daily basis at work the what comes in from the road trauma, and the illness side. And I found that there was a gap where people are missing basic training. And if people have that basic training and that confidence to know how to handle in a situation that they come across or they find themselves in, it makes a huge, huge difference in the outcome and in how we can manage them when they get to hospital. There's nothing more heartbreaking as a medical professional than when a patient gets to hospital and you assess them and you see that their illness or their injuries is something that could have been managed had someone known some basic first aid. But because they didn't, then by the time they get to us, often their injuries are so much worse or sometimes not even survivable. And I think that's what sort of drove my passion into trying to educate the community at large. I did my instructor's course a couple of years ago through the Resuscitation Council of South Africa. So I now teach members of the public, I teach school teachers, I teach parents, and I teach medical professionals as well. And we teach a whole variety of courses, from anything from basic first aid and CPR right through to advanced life support. And it really was the reason I got into that was wanting to teach the community those basic skills. I think people who haven't had training feel that they're not equipped, they're not knowledgeable enough. Because they're not medical professionals, they feel like they have no idea how to help. And actually, they have the skills. If they just have a little bit of training, they actually have those skills that are literally life-saving. And I think when I find, my point when I teach courses is actually to instill confidence in people rather than fear, which takes me back to the point you made at the very beginning, is that we don't want to instill fear in riders that every trip they go out on, there's going to be an incident. We hope you never have to use the skills. But I would like riders to feel confident going out on a trip or a ride, that if something were to happen, they actually do have the knowledge, the capabilities, and the skills to manage a situation safely and to initiate emergency medical care until such a time that a health professional takes over, whether that's a paramedic or a nurse or a doctor. And that's really why I got into the teaching, was to bring about some understanding, some learning, and some confidence in how to manage emergency situations.
What's nice for me is that it almost completes the picture in this particular case with motorcycles involved, that you didn't just get involved from an outside perspective. There was also that dual interest. You also like motorcycling as such. So it just completes the understanding better, and knowing what it is, not just what you see in the emergency room, but have a better understanding of how people's minds works and what it is that they go through and experience on the road, on the trip, whether it's a multi-day event or just a weekend thing.
Yeah, absolutely. And I think any training you do as a motorcycle rider, whether that's from the mechanic side, whether it's first aid, all of it needs to be adaptable and applicable specifically to the situation you're in. And you have to adapt it to whatever's going to suit you best. There's always a perfect scenario, but then there's the one you're in, and how do you use what you've got with you, and maybe the small first aid kit that you carry or the small pack of tools that you have with you to fix your bike. How do you do it when you're in the remotest area? So it's not always going to be perfect conditions. And I think having an experience from being involved with the bikes helps me to make the courses that I teach far more applicable. Because I've been there at the roadside in the middle of Mozambique where the guy has fallen and he's broken a collarbone. And there is no way that we're going to get an ambulance out along that sandy half-track road to get to him. So we've got to make a plan. And I'm sure there's a phrase for this amongst you guys, but it's making a plan. And it relies on common sense and logic as much as it relies on knowledge and experience.
I want to change this slightly. I want to go from training and take that word and change it and make it preparation. So preparation is something that'll equip you better for your journey and not just training. Training is not necessarily something we all have to do, but preparation, on the other hand, is with the most basic sets of skills and things that you pack in your bag, you can literally save the day. Am I right?
I agree 100%. I'm definitely a firm believer in the failure to prepare is preparing to fail. A lot of what happens and what goes wrong on trips can be, you can almost guess that it's going to happen because of a lack of preparation. And if you prepare properly, you prevent this stuff happening in the first place. I think just as you would prepare your toolkit to go away on a trip, and you'd pack whatever essentials you need from your clothing and your food, etc., and you plan your route and you do your route prep, medical planning should be part of that as well. And there's a few elements to it, but absolutely preparation, whether it's packing a kit, knowing the emergency numbers, giving those details to somebody who's potentially following your route or at least checking in on you is important. Knowing where you are, where you're planning to be, and what facilities might be in the region of that area is super important. All of this stuff comes down to pre-trip planning.
What should be the basics that you think one should carry with you in a first aid kit?
Okay, well, look, first aid kits vary from really the teeniest, tiniest box of plasters, right, through to very extensive, grab bag, resus bags. I don't think that every rider needs to carry a huge bag. And practically speaking, I haven't met a rider who says they will. But something in the middle, something small enough that it'll fit in a side pannier or in a backpack, is going to give you the basics. And there's some really useful things that you can put in that. And first of all, is to have some stuff to protect yourself. PPE has become a familial term now amongst everybody, but in medicine, we've been talking about it for years. And really what we're talking about with PPE is how do you protect yourself and not get injured yourself whilst helping someone else? So typically this is gloves. It's a mouthpiece, which we use if you have to do CPR, just as a barrier, one-way device to stop you catching anything from the patient. And then something that protects your eyes. So whether that's goggles or sunglasses or, most things that guys are riding with anyway. But these are, I call it my Superman suit. But as soon as I've got these things on, I feel safe to approach someone and check them out. And you can never carry too many sets of gloves in a first aid kit. So always shove lots of gloves in. I know the guys often like them on the bike anyway, if they're going to be playing with chains and oil, etc. So yeah, I would start with your personal protective equipment. Other stuff that's useful, lots of gauze. In a standard first aid kit, you will get a couple of pieces, and it's never enough. Lots of gauze. This stuff is beautiful for stopping bleeding. It's really, really useful. And a couple of decent sized bandages that you can wrap around gauze, and you can also use to splint or immobilize a broken bone, for instance. You can get creative with anything else you can find, whether that's sticks that are at the side of the road or it's the mud guard flap from the bike. Works very nicely as a splint as well. You don't need to carry specific medical splints that just take up a lot of room and space. So use what you've got around you. Duct tape is brilliant. It's fantastic for, again, strapping one leg to another leg, all sorts of things. But a couple of good, decent sized bandages, crepe bandages, work very well. Burn shield or burnies of some kind is also very useful. I think common injury on the bikes is the back of the calf on the exhaust pipe and a nice burn from that. So something that will help with the pain of the burn after you have rinsed it under lots and lots and lots of water is something like a burn shield. And some sort of cleaning product. Everyone has something that they like to use, whether that's Dettol or Savlon. I like those little betadine creams because, one, they can't burst open like a bottle of Savlon would. And you can put some water in with it. It makes a really nice cleaning solution for cleaning down a roasty or a dirty wound of some kind. But also it's a nice topical sort of antiseptic for burns and for any kind of graze or injury. So that's also something I find useful to put in a first aid kit. Most first aid kits you'll find will have scissors in. These are pretty useless. They're not sharp. They're very small and useless. And I would find most guys I know tend to ride with a blade of some kind anyway. So that will work much better than scissors would. Super glue is also a useful addition. Again, this is a bit bush medicine, but if you're out in the middle of nowhere and you've got a wound that could really do with stitches and you don't feel like going to find a clinic, then as soon as the wound has stopped bleeding, a couple of drops of that and pull it straight, it will heal up quite nicely, but it needs to be cleaned out first. And yeah, I'd say that's kind of the standard components of a kit I think are relatively useful to have.
I always think about if you had to wake up in the middle of the night and you were in the middle of nowhere, wherever that might be. I've never found that on a map. But things like waking up with very bad diarrhea, nausea, vomiting, and pain. So those are one of those three things I always carry with myself. I mean, that, if anything else, will relieve the immediate discomfort, isn't it?
100%. So, what we've talked about so far from a kit perspective is what I would say is the first aid kit, but it doesn't contain any medicines in. I'm always very hesitant to say to someone who doesn't have medical professional training, I'm always very hesitant with saying about carrying medicines. Yes, carry medicines by all means, but carry them for your own personal use. Be very careful about distributing and handing out medicines to other people, because what is safe for you may not be safe for someone else. And there's a big difference between you carrying them for your own personal use and then someone saying to you, listen, I've got a absolutely killing headache. Do you have a painkiller? And you offering them what you have, but them choosing something that they know and they've taken before, rather than you saying, yes, here, take these, and giving them a handful of tablets that they don't know what they are.
Thank you for pointing this. Can I just interrupt you? And I think it's a very important point, and I don't think I've ever thought of it this way. There's a very clear distinction between a first aid kit and carrying medicine, because that's not constituted as a first aid kit, is it? First aid in this case means something completely different.
It does. Yeah. First aid is really your first response in the event of an illness or an injury. And your kit generally contains things that they don't go off, they don't expire over time, and you're not going to give them internally. You're applying them externally on the body. whereas medicines carries a whole different scope of benefits, but also problems. And that's why I always tend to advise people, take what you want for your own personal use. And also you should check this stuff before every ride, because medicines expire. So check before you go on a trip and take the stuff that you would want to use for yourself. But in terms of what you should take, exactly as you listed, I would say you want something for pain. Whether that's a combination of an anti-inflammatory like an ibuprofen, or something with an anti-inflammatory in, something with paracetamol in, and something with something a bit stronger like a codeine in that you find in your Mybudans, etc. So these are nice painkillers. On top of that, you've got things like topical painkillers like your Transac patches. These work really well for soft tissue injuries, strains and sprains, and you put them on the outside of the body so they don't carry the side effects of swallowing a tablet. Then you've got your typical anti-sickness tablets, your anti-diarrheal tablets, and your tablets for spasms, so your Buscopan. These work wonders because almost always on one of these trips, someone comes down with gastro, someone eats something dodgy, and there's nothing worse than feeling like you need to be at the toilet every 2 minutes. So they do work, and they're very useful. And rehydration with that. So some kind of rehydrate sachets, that you can mix in with water works super well. Other ones to add to it would maybe be some kind of antacid, for heartburn, and a glucose sachet. Glucose sachets are very, very useful. You can buy them from a chemist. You can get those sports ones that contain glucose, or you can even buy those honey sachets, or just simply pick up a couple of the sugar sachets that you have and you stick in your tea and coffee. These are so useful because they absorb straight from the mouth. You don't actually need to swallow the medicine to get the sugar into your bloodstream. So if you have someone who's drowsy and not really coherent and not really with it, and you're wondering, is it just a low sugar, which is a common problem, all you can do is rub some of this on the inside of someone's cheek, and that sugar will absorb within minutes into their system and really makes a huge, huge difference. So yeah, sugar's definitely a good medicine to carry as well.
Your preparation should also be understanding who it is that you're riding with and if they have any particular needs. Because, like you said, you can't just give an aspirin necessarily to anybody, because she might have a problem that might be made worse by the aspirin. But you might also be traveling with a person who's got a chronic condition. So the onus is on you as a rider to inform someone in the group, whether it's a leader or just a friend, to say, look, I do have a problem. I am allergic to these things. I am type 2 diabetic, or whatever the situation might be.
It's helpful to let the other people around you know what you have and know how to help you if it gets to that stage. And hand in hand with that goes what's happened in the past. So if you've got a guy riding with you who has had 3 heart attacks before, it's well worth his team and his friends knowing, because if he starts sweating and starts clutching his chest and saying, no, I've got pain, really, he's the kind of patient that you want help on the way to as soon as possible. You don't want to wait it out and just see if it gets better or not. He's a high-risk patient, so get help on the way quick as possible. History in medicine tends to repeat itself. So what's happened before will happen again, or is far more likely to happen again. And if you know these things beforehand, you've got a good clue as to what's wrong when the patient struggles with something.
It does sound like the extra top box, which was only 25% full, is now full to the brim. But I think it's not as bad as it really sounds. It's more, a lot of it is just personal preparation, getting the basic stuff ready, have it with you, and then also the responsibility of conveying the right information should there be anything.
Yeah.
And this information will also help in the case of an emergency, because someone somewhere on the trip with you if something should happen, will have to relay this information to an emergency person who's going to come attend to you along the way.
Absolutely. And it's much easier to have that information available and on hand and know where it is, as opposed to be going hunting for it. So a useful thing is things like your helmet stickers. I think these are really, really handy. And you can put your medical aid details on there. You can put your blood group on there. You can put chronic medications or chronic illnesses on there. And it's just so easy then to find that information and, like you said, relay it to emergency personnel as you need to, rather than going hunting for someone's medical aid card where you don't know where they keep it, or having to phone their family member to find out those details. And all of this takes time. And really, if an emergency happens, you don't want to be wasting time. So to have this information on hand makes a huge difference.
Hydration is a very important factor, and I think that's got so much influence on every aspect of an emergency situation. Whether it's the sun baking down on us, you have a technical emergency, you have had too much to drink the night before, which is all part of what happens to us as riders. Tell us about that. Let's talk a little bit about hydration and the importance of it.
It's probably the most applicable and relevant medical, I say medical, but an illness that goes wrong. And this really affects everybody, often just to from a mild degree of cramps and feeling dehydrated and getting a sort of headache from it, right through to really serious cases of heat stroke. And unfortunately, I know of personal cases where this has resulted in catastrophe. This is an entirely preventable problem just by preparing properly. Plan where you're going to be, plan how many stops you're going to have, plan the timing that you're going to go out, because it's not clever to be out in the hottest part of the day, far from help and with little fluid on board. Look at what fluids you're taking with you. Hydrate before you go out to ride. I think a lot of the guys are avoiding it from a purely practical perspective. They don't want to be stopping often. But if you hydrate properly, you prevent this from becoming a problem. So hydrate properly in the day leading up to the ride and the morning of the ride. And we're talking water, not caffeine, because caffeine, as we all know, half an hour later is actually going to go the other way and cause you to pee out everything that you've drunk. So caffeine in umpteen cups of tea and coffee is not necessarily a good thing, but lots of water. And then take plenty with you. I think most riders that I speak to have said they have learnt from experience that you must sip frequently and small sips often. And you have to get yourself into a mindset of taking a sip of water even when you don't feel thirsty, and just remembering to do it frequently, which is why the sort of camelback option works nicely, because you don't have to keep stopping the bike to have a drink, but you can keep having a sip as you go. Because by the time you're already thirsty, you're getting into a danger zone. You're getting into dehydration by the time your body's telling you, I'm thirsty, I should stop. So taking small sips and often is very helpful and useful. With that goes your comments about, particularly on a trip, the guys drinking too much. And we know this is typically the first night in the bar. The guys are all very excited to get together after a while, and everyone has a few too many drinks. And now they wake up in the morning with nasty hangover. They miss breakfast. They miss hydrating in the morning, and they're dehydrated as a result of the booze last night. That combined with the fact that you're going to be slower because you're feeling miserable, and you're probably leaving later than you expected to, so you're in the heat of the day, is really a recipe for disaster. So try and avoid that where possible. And if you know it's happened, expect that you're going to be slower. You may end up taking longer than you planned for the ride, and make sure you've got enough fluids to cover for that. I would always say you should replace some of the salts and sugars that you're losing. We know when we sweat, we don't just sweat water, we sweat salt as well. So make sure that if you're having water, you want to put something into it, whether that's a rehydration sachet or some other combination. Everybody has their own magic one. That's fine. Stick to what you know. My advice is always 2-to-1. So two bottles of water to every one bottle of some kind of sports drink hydration supplement. So you're diluting it right down. And small sips and often. And this is all sort of the prevention of it happening, because once you get into an issue with temperature and dehydration, you're really starting to play with fire. And what typically happens, that guys will notice to start with, is they get heat cramps. I'm sure everybody's felt this on a ride before. Muscles start cramping, and this is usually down to having sweated out those salts, those essential salts that help your muscles contract normally, and being a bit dehydrated. Now that's a warning sign that you should be stopping and hydrating and replacing, and also starting to cool down. So find yourself a shady place, strip off the layers, cool yourself from the outside with some cold water and some kind of fanning to cool the skin down. And it's a warning sign, because from there you become heat exhausted. And this is where you feel that your energy is completely sapped. You've dropped your bike and you actually just can't pick it up again.
I just want to quickly recap on what we've discussed so far. All of this sounds like an extra top box full of extra stuff, but it comes down to the basics again. It's really just about preparation. All of these things, with the most basic stuff in your medical aid kit, not your first aid kit, is things that is completely preventable.
More important than carrying kit is understanding how to use it. There's no point having a kit of stuff that you've never looked at, and then there being an incident and you grabbing this kit, opening it up, and haven't got the first clue how to use any of it. So if you're going to take stuff, make sure it's things you would find useful and that you know how to use. And I would say your knowledge is more important than how much kit you carry. Your knowledge in, like we've said, prevention and planning, and then worst case in how to treat something if an emergency was to happen.
If we move on from here now, you find yourself in the unfortunate situation where there is an incident and you have a couple of emergency numbers with you, whether it's on your phone or a little sticker somewhere, and someone needs to either make a phone call right there or drive back a couple of kilometers and convey this information to the medical services personnel. What are some of that information that you think is important to have with you when you make that call and that they would want to know from you?
This is a really important topic for me, and I think it's really where you should start with in any emergency. Even if you don't feel skilled enough to provide first aid practically, everyone can make a phone call. And by knowing the right number to call, first of all, and then the right information to give, makes a huge difference for that patient. And I'm always surprised that people don't know even just the basic emergency numbers to call. Now in this country, you've got two options. You've got private and you've got government assistance. And normally the moment I say government assistance, everyone's eyes roll and they go, well, they're useless. And I agree to some extent when it comes to time frame and how long you may wait for help. But there are very useful things that you get from phoning a government number for help that you don't always get with private. So I'll briefly talk about it. In terms of, first of all, phoning for private help, we're talking about phoning for a private ambulance. And there are lots and lots of different private emergency medical services that run countrywide, run throughout the country. I know in Gauteng alone, I think we've got over 30. So it's well worth finding out who operates in the area that you're going to be riding in or the area that you live in. But the two most important ones that operate countrywide, so you can get response from them wherever you are in the country, are ER24 and Netcare 911. So their numbers are 084124, which is the ER24, and 082911, which is Netcare. And they really are probably the most useful emergency numbers to have. And then on top of that, like I said, you've got the government. And just as a quick brief overview, yes, your emergency time, response time may well be longer with a government service, but there are useful things with it. Probably the most important one from a biking perspective is that the government number, which is 112, that's the cell phone government emergency number. That number is your emergency number that will dial even when there is no signal. So, when on top of your phone, when you take the SIM card out or there's no cell phone reception, it will say emergency numbers only. That is reserved for that 112 number. So when you find yourself in the middle of nowhere and you don't have cell phone reception, you can't phone 082911, you can't phone your emergency medical contact number. You can phone that 112 number. So I find it really useful for that regard. It's also a free number, and it will dial from a locked phone. And the last thing that's particularly useful is that you will get all emergency services by phoning that number. Because if you come across, for instance, a car accident and there's a patient stuck inside that car, you may well need the fire service in order to actually open the car up. Or you may need police and traffic control to manage the traffic of a highway accident. And these services you will get by phoning the government number, as opposed to if you phone for a private ambulance, you will get a private ambulance, but you will not necessarily get all the other emergency services that you could do with. So it's always useful just to bear that in the back of your mind. But moving on to what you asked me, which is what sort of information would you give on the phone? There's 5 pieces, I think, of information that are vital for you to give in an emergency to emergency services. And I would always start with your name and your number. And the reason I say start with this is that a lot of the time, if there is poor cell phone reception, the phone might get cut out. And what you don't want to have to do is then phone again and go back through a switchboard and then be referred on to an ambulance. Whereas if you've given them your number already, they can phone you back. So always start with your name and number, and then give them your location. And you want to be as exact as you possibly can when it comes to location. In a built-up area, it's quite easy to give a road name, to give landmarks. But when you're out in the middle of nowhere, it's quite hard. A lot of the private services will give you a cell phone number that you can then send a location pin to, which is helpful. But taking note of things like when you turn off a main road, just making a point of knowing where that junction was or what the location of that was before you entered, say, a dirt road is useful, especially if you need to call for emergency assistance, to kind of give them the best directions to find you. So location.
And the next you can, of course, just to interrupt you, they have GPS coordinates.
You can indeed. So GPS coordinates work very nicely, but again, it depends what you're working with, whether you've got a GPS, whether you've got apps on your phone, etc., to give you that kind of information. But absolutely, that's similar to giving your location pins and stuff. It works very nicely to give GPS coordinates. But again, relying on whether you've got either data reception, cell phone reception, all of these things come into play. And I won't profess to know a hell of a lot about your different GPS devices and tracker devices and that kind of stuff. But again, that's a whole nother avenue of trip planning, is what device are you using to track your routes, and is that device capable of emergency calls or emergency messages or alerts? And there's a whole scope of information you can research into on that, but it's certainly not my area of expertise.
Then there was the other two facts. You were talking about 5. So
Sure.
name, surname,
Yeah.
or cell phone number.
Well, name and number sort of go together. Location. Thirdly would be nature of the incident. So this is just a brief look. We're at an accident scene. It's a motorbike. Or we're at a road accident. There's 3 cars involved. So just a brief nature of the accident. You don't need to go into a lot of detail, but just give them a brief understanding of it, whether it's an injury or an illness, really. Whether I've got a guy here who's complaining of chest pain, or whether I've got a guy he's fallen off his bike and he's lying unconscious. The next one, which is really important, is to say how many people are involved. It's something people often forget about. But if you, say, for instance, came across a taxi accident and you decided to be a good Samaritan and call that in for help, it's important to tell them that this is a taxi and there's 13 people, because otherwise they will send 1 ambulance, and 1 ambulance is not enough for 13 patients. So just the number of people involved. And then lastly, this kind of goes hand in hand with the nature of the accident, but what you see or what you think is wrong from your initial observation. So just from seeing and assessing a scene, we've got an unconscious patient lying here, he's come off his bike. That will give them a good clue as to how bad they think this is and what sort of emergency personnel they want to
With
send.
that basic information, that's already a good start for them to not only find you, but have an idea of what it is they can expect when they do come to evacuate a patient.
100%, yeah. And it's also, that should only need to take you maybe 30 seconds, a minute, which you can be doing with your phone on loudspeaker right next to the patient if you need to do something for them, rather than you rooting through their stuff, looking for medical aid details and trying to contact the family member to find out if they've had some chronic condition in the past. This stuff is not the necessity emergency information to give them. Having the medical aid details helps, because one of the first questions a paramedic from a private medical service may ask you is, do they have medical aid or not? But as long as you can say yes, you don't need to give them all the details over the phone. So it's really a very brief bit of information, but enough for them to start putting together what they think might be wrong and getting out to you and giving you assistance, because every minute helps.
So every situation will be different, isn't it? So there's, like you said before, there's no hard and fast rules when it comes to an emergency situation. But if we cover the basics, then your person that's interested, the person that's injured should be fine.
Yeah, absolutely. First aid is all about really applying a principle. It's understanding how to apply that information and that training, no matter what the situation is. So what we teach you is a framework, is a principle of how you approach a patient, how you examine them, what questions you need to ask, what you need to look for to keep that person firstly alive, so to promote life and preserve life. Secondly, to prevent any injury or illness worsening, to stop it getting worse. So this is the patient who, like we said, has got too hot. How do you stop it from getting worse? By giving them shade, by hydrating them. And lastly, how do you promote recovery? How do you actually start to make them better? And that's really the goals of first aid. And the way we train is we give you a framework and a set of principles to apply no matter what the situation is. And as long as you apply that, you can do exactly those 3 things. Most importantly, keep the patient alive. Secondly, try to prevent whatever they've got from getting worse. And lastly, try to start getting them better. And you can really apply them to any situation you come across.
Jude, thank you very much for shedding some light. I mean, we've just really just covered the pinnacle of this. There's so much more information, and this type of scenario or interview can just carry on for hours and hours. with so many different things. But do the preparation, I think, as we said in the past. And then if you wanted more information, maybe one person out of your group or a whole group together can indulge in some training with a medical professional like yourself to help shed some more light on scenarios where we find ourselves in a roadside emergency.
Yeah, obviously promote my course, but at the same time, it's because I'm passionate about it. And I think it's a really useful way of doing some training and just furthering your knowledge and feeling a bit more confident in managing a situation if you ever come across one. Hopefully you never have to use it, but it's there and it's life-saving if you do. So the courses we run are very practical. They're sort of a one-day training. It's first aid, but very much geared towards the rider, and it's very practical orientated and essentially training using the kind of equipment that you could carry on a bike. So not having these extensive big kits, but something small that will fit in a side pannier, and all about applying, like I've said, that sort of framework to no matter what situation you come across. So if anyone's interested, we've got a website. It's www.cpr4life, that's the number 4.co.za, or else my email is drjude@cpr4life.co.za as well. And if you're interested, let me know. And we have courses frequently, and I think it's a really useful training thing. It's only a helpful set of skills to add to your belt for making riding both fun but also safe.
Thank you very much. I will also put that information in the show notes, or if you wanted more, you can also email me at graveltravelpodcast@gmail.com, and I will gladly pass on the relevant information. It was our plan to present a set of courses, but unfortunately due to COVID we had to postpone those. Jude, thank you again for all the information that you have given us. We really appreciate that.
It's an absolute pleasure. Thank you for having me, and thank you for putting this together. It's been wonderful.
Thank you.
Right, cheers. Thanks. Bye.